bedside, right?
Yes.
All of you are aware that there may be a risk involved when we keep the medication in the bedside. Let me tell you, this time in this particular week, wherever we have observed, the practice have improved a lot. Right? Thank you for ourselves, right? We have done a good job for that particular. And there are certain, last time we reported a incident report form, and then we decided about that incident report form that will make a case report, so that where the things can go wrong in a medication administration process, which you have seen some time back, right? So that process, our idea is all the nurses, all the staff in the hospital are aware that where the things can go wrong, so that next time when you are giving a medication, you know that why I am doing so and how safe my practice is by doing this, right? That's the whole idea behind giving you a case report of this particular errors, right? Is it helpful?
Yes.
Next time whenever a error happens, do you want us to do that?
Yes.
Yes or no?
Yes.
Yes?
Yes.
Will it help us in improving the safety in the hospital?
Yes.
Okay. So, where is it to this? Right. Let me share with you an incident which has happened in this particular area. There was a diabetic patient who was supposed to take Lantus, and the dose was to be decided based on blood sugar level, right? In this particular case. So what here doctor has done, he has written it like this. I don't have a board to write it. Can we write somewhere?
It looks like 66.
Right? Can you guess it if I write like this?
Yeah.
No?
It looks like 66.
Huh? What it may be?
No,
Huh?
not to be given.
Huh?
Nothing.
Nothing to be given. Anyone else? 66, one answer. What is this mean?
22.
This dose mean what?
22.
Huh?
LL.
What else it can be?
Argumenting LL.
Huh? What else the meaning can be, right? You can just interpret the meaning.
LL.
Huh?
44.
22.
Okay. 44. So a patient with same blood sugar level will get 22 units, 44 units, L unit, which I don't know how. Right?
Low unit.
So right? So when the nurse asked this particular doctor, how many you have written? You know what the doctor replied? Whatever I have written, give the same. Right? Because that doctor may not be knowing that what she has written also. So seeing this particular incident, right? This is a warning for us in the system, right? Right? What I am going to do is next week, I am going to all my case sheet. In this particular week only, I am going to check all the case sheets, especially drug chart for illegible handwriting. Right? We'll identify those doctors whose handwritings nurses have difficulty in reading. Will it help?
Yes.
Identify those doctors, and we will call those doctors in this particular room. Right?
Yes.
Teach them. Right? Will it help?
Yes.
I will take this initiative and do it for you.
Very good.
Right?
Thank you so much.
There is another issue we have noticed is when patient is on multiple antihypertensive drugs, right? There are 4 or 5 different antihypertensive for the patient. What is the usual practice? I want to understand from senior nurses. A patient is on alpha blocker, beta blocker, some calcium channel blocker, and all are written BD. So how you deal in the ICUs? Can you tell me? Any ICU nurse? You are an ICU nurse, right? How you give such nurse? We are just trying to understand the process, how it is happening in the hospital.
Little louder, please.
What she says, in ICU we usually give a gap between these particular medicines. I want to understand from senior nurse in the ward how it is done. Somebody senior in the wards, can you please tell me how you do that? I'm just trying to understand so that we can educate our people. Same thing, the gap.
Doctor will mention the time also.
Problem here is some doctors do it, they mention the time, give at 10 o'clock, give at 8 o'clock. but many of them do not do that, right? Right? When we meet in drugs and therapeutic committee in this particular month, I'm going to tell them this is the problem in the hospital. We'll send a circular from chairman of drugs and therapeutic committee to all the consultants to mention the time for antihypertensive drugs when there are multiple, right? That I will do. But till that time, how we can bring the safety in the hospital? Any suggestion? What we can do? Can you suggest something? What we can do, brother? Do you have? Correct. Any suggestions?
Suggestion, one thing is they can whatever sister said, timings you can mention.
Correct. So if doctor has not mentioned, at least we can ask the doctor to mention. Can we do that?
Yes.
Till we send the circular through drugs and therapeutic committee and all this thing. Will that work?
Yes.
Right?
Yes.
Very good. So we'll be doing that particular part, right? Next important things are, yesterday I was driving, I got a call about a drug. How to give that particular drug. Right? Do we have some drugs where most of the time we have a confusion in giving? Do you remember some drugs where juniors, this has to be given in specific way and juniors always have trouble? Yes, pharmacists, do you know some drugs where there is always a trouble? Any seniors? Sodium bicarbonate, you have trouble how to give that, right? Anything else? Huh? Ecosprin tablets. Can we make a list of these particular drugs? Like, I will give you an example of this particular drug. It was a Terifrag in a pen form, right? How to dial it, how to use it, right? Can you identify those drugs and give me next week that list? Then we make a uniform things like I gave you for those drug administration, so that it helps all the area. Will it work?
Yes.
Will it work?
Yes.
So will you give me? Yes, that list? Okay, your area in charge is, you are responsible for preparing your list, where you feel that your nerds may have difficulty or you yourself want to train them better. Okay? I gave you an example of Terifrag injections. Always, many times, nurses have difficulty in giving that words, right? You want to tell something from your experience? What else we need to do?
Nurses are coming in and we need some training on drug calculations and food calculations, right? Do you prefer that? Their opinion.
About the calculations and all, fluid calculation, do you want a class?
Yes.
Most of them require that.
So, shall we include in next month's agenda of including drug calculation classes for the nurses wherever you want?
Drug calculations and food calculations.
Because he mentioned the new staff coming in. Are you comfortable with them, their crash card training? Or you want me to take crash card training for them?
Yeah, for the new joinees,
Huh?
Yes,
definitely.
definitely.
Okay. Can you please give me your area's name wherever you feel that crash card training is required one of these days in evening? This is 15 to 20, less than half an hour training required.
Or they can include in their
Class
training also. Every Friday they have one class.
Class.
I think some of the areas are calling you for flashcard training.
Some of areas have already called me. If you feel that, you please call me. I will give you time. With mutual consent, we can finish it. Right? Will that help?
Will take care of this, yes.
Yes. Do you have any other person having any issue related to medication safety you want to discuss? I will just read those errors, prescription errors which has happened. Our idea is to make you aware. There was a patient which was prescribed clopidogrel and diplet, both of them. Both of them are clopidogrel, right? Different brands. There is a patient who was prescribed tablet Brilinta 180 mg 12th hourly. All of you know what is Brilinta? This is a new antiplatelet agent, relatively new, not very new. So what is the dose for this, pharmacist? 90 BD, 180 mg stat and 90 BD, right? This particular patient, it was prescribed 180 BD, which was corrected. Patient was allergic to aceclofenac, right? Second drug in the drug chart was ifenac, right? So you have to be careful in checking drug allergy, right? Drug allergy should be checked always. There was a patient for which tablet Voviron 80 milligram was prescribed. What is the dose for Voviron? 50 mg or 100 mg, right? That's the dose. This is a very classical case where injection Decadron 2 gram was prescribed for a patient. Decadron 2 grams. Do you know how many grams this injection comes? 8 mg. 2 gram was prescribed. So how many injections are required? By all the staff from the pharmacy, that's what he says for one patient. So I told you always a rule of safety. What is that rule? If you require more than 2 injection of a drug, always question, is this the right dose? Until unless you are satisfied, don't administer that drug. Will that help in such cases? Preventing such cases? Yes or not?
Yes.
So always question when you are giving more than 2 injections of a drug. I think this covers those areas, and let us discuss if you have any other. One more thing, important thing is I am updating my look alike and sound alike drugs, right? Do you have feedback that this drug need to be included in look alike, sound alike? Anybody giving? Can you give me this feedback from at least before next week? If you feel that in your area this drug is looking like or sounding alike and there is a chances of errors and it should go into the hospital list, right? So give me those names if you have any. From my side I am updating it, I will be doing it. But if you have some feedback, please provide me that feedback. Do you have any other issues related to this? Anybody who wants to bring new safety concerns or want to say that there is an issue there, we need to sort it out? Do we have anything?
Chemotherapy, is there any problem? Mixing up a medication are also.
Okay. Do you have some special kind of training? Please bring it through this particular forum that we need this particular training, or you can always consult your medication nurse or educator, nursing educator for that particular training if you require. We are always here, right? And from this particular group, I want at least 4 or 5 people who can give training on my behalf. Right? Can we do that? Will it help?
Much.
Yes. He is saying I am ready.
Shyam will be the educator.
Yeah, what he is saying that I am a good teacher. I can always do it.
Okay.
Do we have any other issues?
No, sir.
No? Thank you very much.
Thank you,
See you
sir.
next